We present our study titled En bloc resection of bladder tumors using transurethral enucleation with a bipolar electrode. En bloc resection of bladder tumors (ERBT) has been considered clinically safe and effective, and is performed using various devices such as a modified loop electrode or laser energy devices. Tube electrode, which was developed for the treatment of benign prostatic hyperplasia, could be useful in en bloc resection of large non-muscle invasive bladder cancer and submucosal bladder tumors. This slide shows the construction of tube electrode. The tube electrode is equipped with a spatula and a standard loop electrode. We demonstrate ERBT using a tube electrode. The bladder tumor is lifted at its neck using the spatula. The normal bladder mucosa is excised at the border of the tumor using the loop. Once the correct layer is reached, as recognized by the superficial muscle, dissection of the bladder tumor is performed circumferentially. The bladder tumor is eventually resected en bloc and removed from the bladder. If the resected tumor is notably large to remove from the bladder, it is evacuated using a mulcerator. Bleeding from mucosa is controlled using coagulation. We now present actual cases. First is a case of submucosal bladder tumor. The submucosal tumor is lifted at its neck, and the normal bladder mucosa is excised at the border of the tumor. Once the correct layer is reached, dissection of the bladder tumor is performed circumferentially. Bleeding from mucosa is controlled using coagulation. If the specimen is notably large for en bloc removal from the bladder, mulctation is performed without placing excessive pressure on the bladder. Second is a case of a large non-muscle invasive bladder cancer. We recognize the position of both surethral orifices. The tumor is lifted using the spatula, as in the previous case, and the bladder mucosa is cut. After recognizing the superficial muscle layer, the bladder tumor is dissected circumferentially. Bleeding can be controlled by coagulation with a loop. Cup biopsy at the base of the tumor is performed after en bloc resection in patient with urothelial carcinoma. En bloc resection of the bladder tumor using the tube electrode allows minimally invasive surgery in patients with large non-muscle invasive bladder cancer or submucosal bladder tumors. Further studies with a large cohort and longer follow-up are required to validate the oncologic outcomes and efficacy.